Here's a question I've been asked thousands of times over 30 years in practice right here in Chatswood. Why does my lower back keep hurting? In this video, part 1 of 2, I'm going to give you the honest answer. The 5 most common causes of lower back pain that I see every single week. And in part 2, I'm going to show you what exactly we do about each one. I'm Dr. Brett, and I've been practicing at Family Chiropractic Chatswood since 1996. 30 years, making us the longest standing chiropractic practice in Chatswood. We are a multi-award winning family-based practice, and I also serve as an activator technique instructor. I'm qualified to teach chiropractors and chiro students across Australia and throughout the globe in one of the most precise techniques available today. Let's get into it. Cause number 1, spinal joint dysfunction, or what we as chiropractors call a subluxation. This is where one or more of the joints in the lower back or lumbar spine lose their lumbar alignment. This can lead to a decrease in the range of motion. The muscle's going to spasm, tighten, or stretch on one side, and inflammations are going to occur around the joints in either a chronic or an acute pattern. There will be degenerative changes, and this even affects the nervous system. As a result, it can happen by things as simple as prolonged sitting, something I see consistently in desk workers and students across Chatswood and the North Shore, from old injuries or from repetitive movement patterns. Here's the tricky part. It can be completely painless for months or even years. The muscles compensate, they overwork, and eventually you bend to pick up your shoes and your back goes. This is the cause that best responds to chiropractic care. And this leads to cause number 2, muscle strain and ligament sprain. This is a common acute cause, but is set up due to being subluxated. It happens from lifting with poor technique, a sudden twist, or even sleeping awkwardly. The lower back supports the entire weight of your upper body, so these tissues are under constant load every day, all day. Most people rest it settles down, then guess what? It comes back. Without addressing that underlying cause and those joint mechanics, it will keep coming back. And when your joints are misaligned or subluxated, this can then lead to cause number 3, disc issues. The discs between your vertebrae are like shock absorbers. They can bulge and push outwards and irritate the nerves nearby, or those discs can degenerate and start to lose their height over time. When a disc irritates the sciatic nerve, you then get that classic pain and numbness or tingling shooting down to the leg from the lower back, even into the buttocks, toes and feet, and that's sciatica. And it's more common than what people realise. Cause 4 is becoming one of the most common problems that I see in people under the age of 40, and that's postural stress. Due to prolonged sitting, forward head posture, hours on screens, and this creates a cumulative load on the lower back that most people don't even notice building up. That is, until they do. Hip flexors and pec muscles, they tighten. Your core and your upper back muscles, they switch off. The lumbar joints become misaligned and they're restricted. And one day, something simple, just like getting out of your car or reaching for something, doing up your shoes, triggers real pain. The lifestyle of the North Shore, long commutes, desk jobs, school bags, study, time spent on your phone, and for some even gaming, makes this one of the most relevant causes for our community. And then cause 5, and this one might surprise most people, is what we call sacroiliac joint dysfunction. The SI joint or sacroiliac joint connects your pelvis to your spine. And when they're slightly restricted, inflamed, misaligned, they can produce a deep ache in the lower back and buttock that can radiate down part of the leg. And that's often mistaken for a disc issue or a hip issue. Things like pregnancy, habits like standing off to one side on one leg or sitting off to one side, or asymmetric sports or poor technique in sport are some of the most common triggers. But it tends to respond quickly to the right form of care. So, those are the 5 most common causes of lower back pain: subluxation, muscle strain, disc issues, postural stress, and sacroiliac joint dysfunction. Now, which one is causing your pain? And what do we actually do about it? That's exactly what I'm going to cover in part number 2, which will drop next week, where I'm going to walk you through how we assess and look after each of these causes at Family Chiropractic Chatswood. In the meantime, if you are dealing with any lower back issues at all, and you just don't want to wait, what we do is we offer a complimentary consultation. No charge, no obligation, just an honest conversation between us about whether chiropractic is the right fit for you. The link to that consult is in our bio and our description, and to book in, please click on that link. I'm Dr. Brett Grant from Family Chiropractic Chatswood. Look forward to seeing you next week for part 2.